Hi, give us a couple minutes to get ready. Are you seeing the PowerPoint presentation? I'm not seeing it. Wait a minute. No. Folks, we just lost our PowerPoint, so I'm going to go. Oh, wait a minute. Here we go. Let's see what this is it. Oh, I know what I need to do. Oh, it's all down here. That's why I couldn't find it. Oh, down there. Okay, can you see the welcome? There should be something that says attendees on it. So click it. Am I big or little on your screen? Okay, good enough. Okay, I'm sorry. otherwise I'll just need to take that.
And I read
Mm-hmm.
so the social welfare policy or under there.
Okay, so why policy?
Off that little list.
Okay, so what about this says policy?
I heard about as a whole with the policy change.
Yeah, yeah, policy is rules. So it's going to be practice and method, there's special population and concession.
Okay. So. And then special populations.
Mm-hmm.
I think it's from the organizers that you can see it. And it says that you have to select my meeting, their meeting history. And that will show all of that.
Why don't you give me one of those checklists?
There's the back of it. No, I just do it without coming to view it. That's in the name. It's from the person who actually accepted the webinar. Their input.
So I've got to put you as a,
Good morning. Can anyone hear me?
yes, we can.
Oh, okay. Can you see me?
No, we can't.
No? Okay. Do you want to
Is
see
this
me?
Ben?
It is, yes.
Okay, Ben. My view is
That-
here you are. Okay. Okay, we're still new to this. We're getting,
Yeah, sometimes I get them to work well and sometimes you just never know. I've been using a lot of different platforms lately. So far so good.
okay. So I'll be calling on you in a little bit.
Okay, do you want me to just, I can get rid of, let me get rid of that. I can get rid of
Okay.
me. Whatever you want.
Okay, good enough.
Okay.
Yeah, exactly.
Just know you guys can be heard. We have a couple more minutes yet as people are still coming in.
Hi, good morning, all. This is Venetia Houston from GCRTA.
Hi, Venetia.
Hi, good morning, Kathy.
Yeah, hi. We're just waiting for everybody to come on board, and then I will be calling you. You will be the last speaker today.
Okay.
And advancing your slides.
Okay, wonderful. Are we doing, you want to do audio and visual?
It doesn't matter.
Okay. I don't mind doing both. I'm open. All right, I'll be standing by. I'm going to put myself in mute.
Okay.
All right.
Hi, Janice.
Morning.
Okay, we'll wait one more minute and then we'll get started. Okay, I see we still have people coming in, but those who came on in time or were a little bit early, thank you. So we're just going to honor your time, and we're going to go ahead and get started. First of all, I want to thank you for joining us today, and to warn you that we're still new to this this type of technology. So bear with us if we hit glitches. We hit a couple last time, so just bear with us, all right? Today's topic is a conversation with local transportation providers in response to COVID. And when you think about it, our world has really changed in the last couple of months, and it looks like it's not going to get back to quote normal in the near future. So we're looking at doing business a different way. And because transportation is so key to our living in the community, participating in the community, working, being part of families, and getting to medical appointments, it's a grave concern to a lot of people. So we brought together two of the area transit agencies and a private transportation provider to just talk about what they're doing, what they're seeing, and sharing their words of wisdom with us. I would like to thank the Western Reserve Area Agency on Aging for joining us in this endeavor, and also a special to, and always a special thanks to the Ohio DD Council. They have helped to fund this project, and they, if you know them, you know that they have their agency that is creative and has a vision of inclusion. So with that, I have a couple of housekeeping notes. Let's see if I can change the slide. First of all, you will be muted as a participant. If you have thoughts or questions, put them in the question box or try the chat box. The last time the chat box, people were saying it didn't work, but I can see it, so hopefully it's working. I put things into the question box. If you need social work CEUs for this, you know that usually you have to sign in and sign out. The state needs proof that you participated. What I'm going to ask you to do is put your name and sign in, say you need social work credits for this. You will get 1 credit. And if you have your license number, put that down. So you can either put it in the question area or the chat box if you can get it to work. Before you sign out, you have to say, this is so-and-so signing out, give me my social work credit. You will then be sent a feedback form. And so once we get the feedback form back, your certificate will be handed to you. Same thing if you need just a certificate of completion. I have no problem with that. We will not give out certificates if you have not signed in and signed out. So I need to be really clear on that. And I'll remind you before we leave that you need to sign out again too. We had hoped to be able to offer CRC credits, and that is not going to happen. I apologize for that, but OOD wasn't able to do that. The other thing is that the slides are going to be available on our website, and you go into, when you go onto our website, look under events, and there will be a tag for archived webinars. Give us a couple days to get that on there. This is new for us, so give us a couple days, but they will be up there and available to you. So what I would like to do at this point is turn it over to Ben Mordish, who is the outreach coordinator for Lake Tran. And Ben, feel free to take it away.
Thank you, and thank you for having me this morning. My name is Ben Mordish. I'm the customer outreach specialist at Lake Tran. I'm also the ADA coordinator and a travel trainer. So I'm going to share with you Lake Tran's response to the COVID-19 situation. In reviewing everything, I noticed that we have quite a few things here that we initiated, so I don't want to miss them. I'll be looking down on my notes periodically. But at the beginning of the crisis, the management team was called together, and they came up with a very flexible operational policy and protocol, reaching out to not only the CDC, but using Governor DeWine's stay-at-home order, and then consulting with the state and local health departments. That continues on a weekly basis. We check back and reevaluate what we are doing to make sure that we're doing everything possible. So one of the first things they did was, as far as sanitation of the buses, it's always been Lake Tran's policy to clean exterior and interior bus surfaces on a daily basis. That's been pre-COVID. That has always been our policy. What we did in addition to that is we added an electrostatic spray fogger, which actually takes the disinfectant and turns it into a fog and gets into every nook and cranny of the bus. And that's done on a daily basis, in addition to high touch point areas that the hostlers attend to when the buses come in. The drivers are supplied with masks, gloves, disinfectant, and they are able to then on their shift and throughout their shift treat those high touch point areas, handrails, seats. We are encouraging social distancing, not only on the dial-a-ride buses, but on the local routes and commuter buses. So they're able to tend to those high touch points throughout their shift. Another major thing that we did was we decided to suspend fares. That began March 25th, And it continues right on until June 30th, where it will be reevaluated. So that's been 3 months where we have not collected any fares, not only on dial-a-ride paratransit, but on the commuter buses and the local routes. And we did this for a couple of reasons. We wanted to make sure that there was as much social distancing as possible with our drivers and with the customers. So we want the customer to enter from the rear of the bus on the local routes. And we didn't want any interaction with money or using a fare box or anything like that. So that's one reason that we suspended fares. The other reason was we don't want to inhibit anybody from a financial concern if they have to get out for an essential trip. What if they have to go grocery shopping, or they have to go to that doctor and they're concerned about money? Now they don't have to worry about that. So that's been instituted as of March 25th and continues on through this day up until June 30th. And that will be, again, reevaluated at the end of this month. So those fare suspension. Another thing we were able to do, we had trouble getting PPE at the beginning, but we've been able to acquire masks, not only for our drivers and all employees, but we actually have masks available for our customers. You can have your choice of a disposable mask, or you can get a washable, renewable mask. Either way, you can either call customer service, or you can go online. We have a little form you can fill out, and we will actually send you a mask so that when you get on our bus, you can use it. Now, masks are mandatory for the drivers, but they are not mandatory for the customers, but we highly recommend that you use a mask. Social distancing, I want to talk a little bit about that, both on the DAR buses, the dial-a-rides, paratransit, and the local routes and commuters. We do have, of course, I talked a little bit about the rear entry on the buses, but we have labeled seating as well, so that we've created some social distance as much as possible within the bus platform. So on the commuter buses, on the local route buses, you'll see seats that are blocked off that we would like you to sit and distance yourself accordingly. Dial-a-ride. On the paratransit, we've tried to do a better job of scheduling so that we can take one person at a time. We try to limit the amount of people on a paratransit bus because it is a very closed platform. So we're you know, I've been talking to a lot of the drivers, and they may be picking up on a 6-hour shift. They may pick up 5 or 6 people. So we've really spread that out as far as safety for the customer, safety for the drivers, because you know, things have changed. And as this progresses, we're certainly not out of the woods. We're at the very beginning of this process. And so we are revisiting everything and keeping very flexible with our operational protocol. Some of the other things I want to talk about are the new fleet that we have. And I'm talking from 2017 to the present. All of those new paratransit buses are antibacterial and antimicrobial material that they're made with on the interior. So that will help us with that situation, in addition to the electrostatic fogging and the cleaning and the extra touch points that we're addressing on a daily basis. The actual facility, our facility is cleaned every day, and it is also disinfected on a daily basis after the shift. After 8 o'clock at night, the crew comes in and they disinfect the entire building. So we're still doing that. And let's see, what else can I tell you? We have a very active website. When you go to our website on the homepage, you're going to see a COVID announcement with all the information that I'm talking about. In my travel training, I have added a riding in the age of COVID public transportation module for students. I want to get the students and anyone beyond the stigma of wearing a mask, of trying to be comfortable in a closed situation. It is new for all of us, but I've included a new module of training for my travel training. We are travel training using the Zoom platform, and also via phone. I've got a lot of senior citizens that I will mail out material to, and then go over that material with them and over the safety procedures that we have. We also have those safety procedures displayed on all of our buses. You can see them, review them. They're on our website. If anybody needs to talk to me personally, my numbers are available on the website as well. And we just want to try to promote as safe an environment as possible for travel for our customers. And I'm trying to think of anything else that I haven't talked about. Masks, boarding from the rear, safe seating. We encourage you to use public transportation. We did have a very drastic reduction in ridership. Normally, our paratransit's picking up 12 to 1,300 people a day. We may be picking up 300 a day at this point. It's gone down dramatically, and most of those are senior citizens that a lot of facilities have not opened up, and a lot of the congregate facilities are still closed. So that's a big reason for the reduction in service. But we're up to about 50% of our normal local route traffic right now. So it has ramped up a bit, but again, we're looking at we're looking at these safety issues and revisiting them all the time. We are going to install some shields for the drivers. We're looking at those now, but we have new buses coming next year, new electric buses, and a lot of new technology. All the dial ride buses that you're seeing out on the road, most of them are the brand new platforms. So we have the turtle tops and the new propanes, and they're absolutely beautiful and extremely well maintained. So we're doing our best to assure safety for our customers and a great ride. And that's what we're doing at Lake Tran.
Ben, thank you. We've had a couple of questions coming in, and like to do is hold questions till the very end, if you don't mind, because I think that there are going to be some common questions among all of you.
Okay.
So I would like to turn it over to get this thing going right here. I love when technology works. Janice Ziegel. Janice is the Executive Director of Senior Transportation Connection. And Janice, you have slides, so just tell me when it's time to change the slide. And Ben, I just wanted to tell you a comment that just came up. This is just a comment. I'm so happy with Lake Tran's approach, very honorable. So I thought you'd like to hear that.
Oh, thank you.
Yeah. So Janice, I'm turning it over to you.
Thank you. And I can't see everybody, but it's good to be with you this morning. And I appreciate the opportunity to talk about the challenges and opportunities that STC has faced. First of all, I'd like to say happy birthday to STC. We are 15 years old this year. And ironically, we had celebrations planned throughout the year for our customers and our stakeholders and our board. And of course, that's totally something different now. But we're still celebrating the fact that we're here. What I'd like to talk to you today about is a brief overview of STC. You can go next, Kathy, please. A brief overview of what we do, critical decision points that we've made in working through this pandemic, how we're managing resources and personnel, and also new opportunities that have come up and challenges. So our service area on the next slide will show you our footprint. And this is statistics from 2019, in which we did about 145,000 weekday trips, 5,000 active clients, 30 partners. And I think you know our model is we contract with nonprofit organizations and cities to provide transportation to their older adult residents. We operate a fleet of 60 vehicles. Most of them are funded by the 5310 program. 65 staff, $4 million. And there's a profile, the characteristics of the type of people we serve. Significantly, 60% have a walker or a mobility aid. You can go on, Kathy. Thank you.
Okay.
You can go next. So I wanted to start here. One more back.
One more ahead.
One more back to critical decisions.
Got it.
Right. So as you all are aware, the timeline of this started to really happen publicly around the middle of March. We had a pre-scheduled board meeting with my board, which was totally a new agenda. And I presented 3 options to them, all with details, financial, consumers, everything, all the data we were projecting. And those were 3 options. What do we do? And should we do everything to stay open? Should we continue to just do our subcontracted work with RTA? Or should we close until further notice? It was a very healthy discussion with the board, a very productive one, but you can tell from my red highlighting that we did everything we could to stay open. That was challenging for us. It was a lot of agility in shifting gears and communicating with our partners. But a couple of things in this decision process throughout the last few months. One thing, when we started to say, what should we do? I called it decision paralysis. We were getting stuck in so many details that we didn't even know about. We were getting stuck in HR issues that we didn't know about. And we had to reach a point of saying, hey, we need to make decisions. And if we make the wrong one, we're going to go back and do what we can to fix it. But we had to be careful that we didn't get too stuck in what we needed to do. It was also important, and still is important, to keep our mission in focus. Why are we here? What is our nonprofit mission to serve the older adults? And let's keep that as the top of the priority list. I want to say the board has been fabulous. My board leadership has been terrific. What I do weekly is send them a summary of our trends, our financial situation, any personnel issues, and I found that to be very important in keeping us afloat. And also, my management team has been absolutely fabulous. We don't always agree, and I like that, but we've really come together as a team. And what we're also assessing is how we can always minimize the risk for our staff and also for our customers. So Kathy, if you'd go next to resources.
Next.
Please.
Okay.
There you go. So in terms of resources, we were able to get an advance from Cuyahoga County on an operating grant that we had for them starting this year. When we decided to stay open, we said we need money. And where are we going to get money in order to ensure we're still here? And we're still here in November. We also received a rapid relief fund grant, $60,000 from the Cleveland Foundation. I have to say they made that process very simple. And they just said, they basically said, how are you going to use it? And we said, we're going to stay open. And that's all they needed. We were successful in getting the payroll protection program grant, which is keeping our staff employed. When I talk about personnel, we have had some layoffs, but for the most part, we've been able to keep people on the team and in our work, even though we've had a reduction in that work. We've had positive negotiations with our vendors. One thing we did when we looked at, hey, we're not using our 60 vehicles, we're using 30. We contacted our insurance company and said, we're going to mothball these until further notice. Can you give us a break on our insurance? They, of course, were happy to work with us to do that. We had to put some processes in place. So in some of our vehicles, we have signs that simply say, do not use this vehicle. We have also had positive negotiations with our landlords. We have 2 facilities, and both of them were saying we're very willing to work with us in rent reduction. The east side or the west side landlord actually gave us a month free. So we appreciated people working with us to make sure we could keep doing what we're doing. In operations, we had a significant decrease in contract revenue. We went from 500 trips a day in our community work to 100. We went from 9 RTA paratransit routes to 3. So in one way, our drivers are saying, hey, this is great. I'm not running, but it had a significant impact on our revenue. We are still steady at about 100 trips a day. Priority is given to dialysis, medical, and personal shopping, which is picking up a little bit. I also wanted to mention that about 25% of those 500 trips a day we were doing were to senior and community centers. And those were full buses. Those were 8 to 12 people on a bus. So that's been an impact, and I don't see senior centers or community centers reopening anytime soon. Personal protective equipment is provided and required of all driving staff. All office staff has also been provided the equipment, but it is optional for them. And of course, as the previous speaker noted, cleaning the vehicles and the facilities on a regular basis and between customers, if we can, is a priority. And of course, limiting riders on vehicles with social distancing. But I would tell you, in our reality, there's usually no more than 4 people on a bus. So the big impact here has really been on people. And if we could talk about personnel, Kathy, next slide. We had a voluntary layoff, and that was about 60 to 70% of our drivers and call center staff. That layoff was based on seniority. We also had a number of drivers who came to us and said, I have compromised health conditions. I would like to be laid off, and we of course work with them. We also facilitated connections to benefits. So for those that were eligible to receive unemployment, we moved that process along very quickly so they would have that benefit. And we continued healthcare and voluntary benefits for those that were receiving it through the month of June, the employer paying that part. For those that stayed, we try to support them with a lot of recognition, a lot of attaboys. I try to buy lunch once a week for everybody here and the drivers on the east side. We've been cashing in gift cards from some of our bank perks and sharing that with our staff, and that's really been something that they've appreciated. We've retained an HR consultant for guidance. When this whole thing started, we were in transition in our HR department. So it was important that we were getting quality advice on how to handle some things that were going on. And it was new for everybody. I know you know that. We have begun to recall some of our employees, again, based on seniority. We've had 8 so far who said, no, thank you. I just don't feel comfortable. Terminate me and I'll deal with it. Those 8 individuals were older adults. So we completely understand being an older adult themselves, they don't want any risk of that exposure. We've applied for the Shared Ohio Work Program, and that program allows us to keep people or bring people back. And even if it's a reduced workload, through that program, they can get paid and make them whole their full amount. So if they come back and they're working 20 hours a week and they used to work 40, they can apply for that benefit and get compensated for that additional 20 hours to make sure they have a full paycheck. I will sadly share with you, we lost a driver to COVID. And I can't talk about it. Okay, Kathy. Thank you. So some of the new opportunities that we've developed is delivering meals for the Community Partnership on Aging. These are pre-prepared meals. We deliver them 3 days a week to different communities in the Community Partnership on Aging area. We have done shelf-stable meal delivery for the Area Agency on Aging. That's been a pretty positive program because it's not schedule contingent. We can do that whenever we have an opportunity in the schedule to slide that in. We've been going to the food distribution site. Right now it's at Benjamin Rose. We pick up the shelf-stable meals. We store them in one of our vehicles, and then as there is a need, we're able to put that in our schedule and deliver the meal. This week, we started a program with a company out of Columbus called Share. They're also a transportation program, but they're trying to regroup their Columbus operation and asked us to handle this Cleveland program, which is transporting 11th and 12th graders in the Cleveland School District to internship opportunities. So that's been a new place for us. We'll see how it goes. It's an 8-week pilot. We're also testing out through this the Share product. We've explored hot meal delivery. I'm not sure that's going to be our next step, but we're trying to remain open to all kinds of potential collaborations with other providers. And that includes subcontracting with nonprofit organizations who have capacity. As you know, in other systems, the developmental disability community are not opening up their workshops or their adult day centers. So we're talking with them to see how we can all work together to get through these next steps. So a couple of challenges that I see coming, and you can go to the next slide, Kathy, is our ability to return to scale. You know, prior to COVID, we were already struggling with a workforce. And now that we're having drivers saying, no, thank you, we're back in that position of trying to recruit qualified drivers. We are working with Ohio Means Jobs, and we're also working with Indeed and other job search sites to get that opportunity out there. Kathy, you can go to the next slide.
Janice, you've got about 5 minutes.
Okay, I'm going to wrap up here. A recruitment of drivers and ability to return to scale. I want to make sure that when things are back to full blown, we are in a position to meet our contractual obligations. Overall safety of our drivers, our consumers is very important. So that's always going to be top of our list, and continuously assessing risk and exposure. I'm pretty sure you all know how to reach me, but the last slide will show you my contact information. I just would like to say this has been a most amazing time in transportation and also in the nonprofit world that I move in. Who would have thunk? I mean, who would have thunk? So it's been interesting to be agile and more creative and tried our best to meet our challenges. I think we made the right decision. And moving forward, I hope, you know, we definitely see the results of that. But again, I thank you for your opportunity, this opportunity. And if you do have any further questions, I'm sure I'll see it in the chat.
Janice, thank you so much. Truly appreciate your being willing to give us some time here. I'd like to turn it over to Venetia Houston at this time. And Venetia is the paratransit transportation manager for the Cleveland RTA. And she's fairly new to her position, and she has a lot of energy and excitement about her new job. So Venetia, let me know when you need me to change your slides.
I will do. Thank you so much, Kathy. First, I want to say thank you so much for giving RTA this opportunity. We really, truly appreciate sharing what we have done, just like the other Lake Tran and STC. I wanted to say, Ben, you did a great job on your presentation, and Janice, happy birthday to STC. And we want to, personally, I want to share my condolences to STC for your loss in your operator. Again, my name is Venetia Houston. I am the acting transportation manager at Paratransit for Greater Cleveland Regional Transit Authority. And today I will be presenting RTA's response of COVID-19. Next slide, please. I'll be sharing with you today a number of topics, but we're going to go over the timeline of events, employment impact, health screening, personal protective equipment, better known as PPE, our sanitation process, social distancing, and operator assistance to the passenger. Next slide, please. All right, so to review the history of COVID-19, on March 9th, 2020, when Governor Mike DeWine declared Ohio as a state of emergency, immediately GCRTA Paratransit experienced and saw significant impact due to COVID-19 the very next day. The very next day, our ridership decreased by 7%. The following week, our ridership decreased by 52% below average. And just 2 weeks after the declaration, our ridership was down nearly 70% below average. I will say currently, since May 31st last week, we have seen an uptick in ridership, about 3% per day. Next slide, please. Employment. When it comes to employment, that has been a very heavy concern with RTA. As STC mentioned, we've had a lot of healthy discussions as well, from the board level all the way down to front line. RTA took immediate action when it came to their employees, in March prior to the federal mandate, all employees were provided 80 hours of sick time, regardless if you had it or not. A task force of COVID-19 was also established, which included management and key personnel to ensure the compliance of not only the governor's orders, but supplies, and also to just the fluid changes that were happening and the challenges due to COVID-19. When the Family First Coronavirus Act, better known as FFCRA, took effect on April 1st, 2020, it protected all of the employees if he or she had FMLA or if they did not have sick time. RTA took this very heavy and made sure that all of our employees were protected. We also moved to virtual meetings, as a lot of other entities and businesses. Was new to us, just like Kathy has mentioned, telecommuting and offering that to non-operating employees to work from home, which has been a great benefit to keep things afloat. But we are proud to say that RTA, as of right now, we have had no layoffs at this time. But lastly, a big concern, as STC had mentioned, we did reduce our hours of purchase transportation due to demand. Again, a 70 decrease in ridership had a very significant impact on how we managed our resources. However, we are proud to say that we did maintain a level of purchase transportation, better known as contracted transportation services, to support the community by keeping individuals employed and also to institute social distancing. Next slide, please. For our employees and anyone on any RTA premises, RTA developed health screening, and this included to ensure the safety of all of our employees and also to the public. We were all required to wear a mask or any type of covering had to be worn. Each facility was designated a registered nurse to perform health screenings, and these screenings include health assessment questions, observations, temperature checks on the forehead using a touchless scanner. Anyone, though, who displayed symptoms or had a temperature that was discovered of 104 degrees was either sent home or recommended to go and get medically checked. We are proud to say that we've only had one person at paratransit who was an employee that did have a significant temperature, and he is actually recovered and he's back to work at RTA. Next slide, please. Personal protective equipment was a very hot topic for RTA. As Lake Tran mentioned, it was very hard to obtain supplies. We've actually had significant hiccups where we ordered supplies and received the boxes, and the boxes were completely empty. So there were definitely hardships when it came to getting the proper PPE for our employees. However, we did manage to be successful. All employees either were supplied KN95 masks, which you can use up to 5 times, and we can disinfect it up to 3 times, which means a good wear could be a good month for one mask. Also, too, we had disposable surgical masks given out to our employees that are still available today. And we're giving 3 cloth masks, which we've had an abundance of employees that came together that physically hand-sewed masks for their coworkers and colleagues, which has been very successful and appreciated. And this includes the disinfectant wipes and also gloves and eyewear. And we even gave out protective eyewear to those that have prescription glasses. Next slide, please. Sanitation, as Lake Tran and STC mentioned, this is a very, very hot topic, and this was the #1 priority in conjunction with safety. So when it comes to sanitation, GCRTA, we had a rigorous sanitation procedure in place, and we're using the Center of Disease Control Prevention, better known as the CDC. It's a Tier 1 disinfectant solution. All of our vehicles are 100% clean every single day. And I really want to iterate that. All of paratransit vehicles are clean every single day. The target areas include rails, seats, the operator's area, and high key touch points. However, it doesn't just stop there. This includes our facilities as well. So those facilities also have a rigorous sanitation procedure in place, but not just our janitor staff, but we also have mechanics and other individuals who have volunteered to ensure that we have a very rigorous sanitation completion for not only our coworkers, but the public as well. Where our target areas include high traffic touch points, doors, switches, better known as light switches, tables, chairs, etc. And they're wiped down with disinfectant solution throughout the day. I can even tell you there are certain times in the evening where I'm out there with gloves, mask on, just touching the bullpen or other areas that I may not see a janitor or someone in probably a couple of hours. So management is taking some efforts as well. In addition, we're using an ultraviolet light moonbeam machine, which use ultraviolet light, and it is targeted to clean our rapid station areas, and also to high traffic areas. They come to every district as well, usually twice a week, to clean those touch points also. And I'd be happy to say this particular cleaning process is mirrored towards our emergency response platform, such as ambulances. Next slide, please. Social distancing and technology. When it came to social distancing, we didn't want to just start with how we're going to do social distancing, but how is our scheduling software and how is our systems that we use in place is going to ensure that as well. And RTA was encouraged and we facilitated many multiple ways to ensure social distancing took place. By using technology, we decreased efficiency by generating direct trips. That means an origin to destination direct with no shared ridership. However, there's still shared ridership, and we reduced that significantly with fewer customers on the bus at any given time. For example, if there is usually shared ridership, it's usually a customer and their PCA, their personal care attendant. Spread trips are created through our entire fleet. Usually we try to increase the capacity by having more rideshare, but as of right now, we're using every single vehicle that we have to ensure that we have social distancing. And this includes our jitney service, which is a shuttle service. We have not just one bus, but we have two buses, as similar to a 60-footer related to Big Bus, if you want to look at it in that fashion. Scheduling has been reduced from 7 days to 3 days in advance, and this is to ensure that our system that we use for scheduling is able to keep up with the configuration changes and the parameter changes that is related to social distancing. However, as we all know, and I hope that you know and encourage, that RTA does go above and beyond, and the FTA allows curb-to-curb service, but we here at RTA, we've always wanted to and push assistance door to door. However, during this pandemic, we must ensure our passengers and operator safety, and we have asked operators to scale that back and only provide assistance to our customers when requested or required. So operators are still liable and obligated to provide that door-to-door assistance, but currently it's not a form of practice right now if the individual is independently able to go to the door themselves or if they do not request assistance. Next slide, please.
It's not, there we go.
Oh, thank you. So this is just, so I covered many of the responses RTA has done related to COVID-19. If you need any more information, please go to riderta.com. We have tons of information on what we've done on the rail side, bus side, and paratransit. My information is there in front of you if you would like to contact me personally. But it's been truly, truly a great opportunity today to share with you what RTA has done, specifically paratransit. Next slide, please. Just wanted to add, if you need any information directly related to COVID-19 from the Ohio Department of Health, just wanted to share this information for those participants that are here viewing our presentations today. Thank you so much, all, and I appreciate your time.
Benicia, thank you so much. It's Really appreciate it. And if I could have the speakers, whatever button it takes to show your faces again, because I know that we have some questions out there. And I'm going to start with two that have come in. And this one was directed at Ben, but the other two, feel free to chime in. So what is the social distance within the vehicles?
Well, we try to maintain a minimum of 6 feet.
Okay.
So on a paratransit, and I must say that we are doing a very good job of when we are scheduling, we're trying to take one person at a time with paratransit. Now on the local routes, there's actually a picture of it on the website. We've lost half the capacity of the bus, basically. We've blocked off the seats and we have designated seating. So it is 4 to 6 feet. It's as much as possible. But again, our ridership is down quite a bit. It's 50% on the local routes. And as Venetia said, we're very low with paratransit, compared to, we've lost, 70 to 80% of our paratransit right now. So at the beginning of the crisis, we were down 90% on local routes and paratransit and commuter. So it's slowly coming back. So, but again, that is a closed environment. Everybody knows that you get on a paratransit bus, even though we've got up to 12 foot of space in there. It's still a small space, but we have tried to just take one person at a time.
I agree with Ben. RTA is mirroring that. We're doing 6 feet or more. And if a passenger, upon arrival, feels uncomfortable just due to someone being on the vehicle or there's too many passengers on the vehicle, they can refuse their trip for the day and not be counted against them at the home.
Janice, anything to add?
No, I agree with both Ben and Venetia. To Venetia's point, we too have encouraged our drivers to offer assistance when needed. Where that's difficult, of course, is many of our dialysis patients who are in wheelchairs. So we're really working with the drivers about how to be as safe as possible in delivering that service.
Thank you. The next question was emailed to me, and I hadn't even thought about this, but how will transportation providers address clients that are unable to enter a doctor's or any other, appointment that they have at the doctor's office until they are called by phone? An example is a patient contacts the doctor's office when they arrive in the parking lot, and the doctor's office will have them wait in the parking lot until they're able to enter the doctor's office. What happens in that instance? I'll start with you, Venetia.
That's a very good question. We haven't had that too much. I know there was 2 incidents that we've actually experienced. But as it relates to the question, the operators required to call dispatch to let them know the situation. And if we're able to, which we have been just due to low ridership, we will allow the operator to stay idle for 30 minutes until, or hopefully there's some connection with the doctor. If it does exceed 30 minutes, unfortunately, we do have to move on, but we do have the passenger have the opportunity for us to take them back at no charge to them, or to make sure that they have someone there at the facility, which has happened before, when they have been in the lobby and had social distancing to wait for their doctor. And we will return when they're at the will call to pick them up.
Okay.
So one thing we've done, and this was earlier on in the pandemic, many seniors were unaware of the fact that their doctor's office would be closed. So when they would call and need to make a medical appointment, we encouraged them, first of all, to make sure they called their doctor back to make sure the facility was still open. We also encouraged them to say, I'm using a van service, to let the health practitioner know that they were using a van to get there. If it's happened in our work, it's happened very seldom. But again, because we have more capacity, we've been able to work with people to sit there for a little while.
Okay.
As far as Lake Tran is concerned, we are one of the things I love about our company. We are door to door. We don't do curb to curb. So the drivers are actually required to escort that customer into the building and make sure they get in. So in that instance, again, we would call, the driver would call dispatch, and dispatch would then call the doctor's office. We have all those contact numbers, and I have not heard of any problems with that type of situation. And if need be, we could take someone home right away. We've got plenty of buses and availability at this time.
Okay, thank you. To the audience, any other questions? I give them a couple minutes to type. I want you to know that we had 92 people that attended this session, and the majority of them stayed. We just lost one just recently, so you guys have done a great job. Thank you. Okay.
Thank you.
I don't see any questions coming on board. So I want to thank our speakers, Venetia Houston, Janice Ziegel, and Ben Mordish. They are very committed to moving people and getting people where they need to be in a timely and safe manner. Just thank you for all the work that you do and for being willing to share some of your time with us. So
thank you. My pleasure.
Thank you.
for folks in the audience, if you need CEUs or certificates of attendance, please send a note through the questions and say I'm signing out with your name. And then if you will be getting an email from Simone Jones from Services for Independent Living with your satisfaction or your workshop feedback form. Fill that out, send it out to her, and she'll get you your certificate. And just a reminder that we have another session next Wednesday, and it's going to be a number of other providers and talking about promising practices. I think that you'll find that pretty interesting. And wait, let me just make sure we didn't get a question here. Nope. So with that, I want to thank everybody for your participation. And again, thank you for the speakers. And this is where I'd have people do a round of applause, but we'll do a virtual one. So thank you. If you have any questions, you can email us at Services for Independent Living, and we'd be glad to help you. So just thank you, thank you, thank you. Oh, wait a minute. I have a question. Does reduced hours for transportation apply to paratransit and regular bus routes? Additionally, when will the hours be extended?
So for RTA,
I'm sorry, go ahead.
oh, I'm sorry, man. So for RTA, bus has reduced their bus time or bus schedules, but for paratransit, that has not been the case.
Yeah, we have not reduced our schedule at all for paratransit. We did reduce the commuters the first month, but now everything is back to a normal schedule. But we never did reduce paratransit.
Okay, great. Just make sure I'm not missing any. Here's another question. What would you say to consumers that are afraid to use buses now? Good question.
Oh, can I go first? To be honest with you, at one of our healthy discussions, as Janice has described, I'm very confident when we went over the rigorous sanitation procedures and the interior cleans that we perform. Our buses right now probably have been the cleanest that they have ever been, to be honest with you. Just to see how much time, labor, money into our vehicles for sanitation, I'm very confident. I'm sure that STC and Lake Trend may say the same thing.
Mm-hmm.
I agree with you. I think communicating effectively with our passengers, and we do that through our relationships in the community. Here's the steps we're taking. Here's the driver training. It was interesting. Things really kind of went to nothing the first week after the governor's order. And then, as I said, we were doing dialysis and medical. This week, we're starting to get some hair salon requirements. So people are waiting for a haircut.
Mm-hmm. Yeah, I would piggyback on that just by saying, yeah, the buses are probably as clean as they've ever been, and but you know, when riding the bus, if you're using PPE and you're washing your hands and don't touch your face, I think you would be absolutely fine. You know, there's a risk with anything, and those are closed very enclosed spaces. But if you use common sense, follow the guidelines that we have posted up there, the drivers are aware of everything, I think you'll be just fine. I don't know of any cases with us personally at Lake Tran that anybody's gotten anything from the virus on the bus. So, and I've been on the buses myself confidently, so in the last few weeks.
And I'm trying to see if I have any more questions. In terms of cost for ridership, any discount due to challenging economy?
Well, again, go ahead, Venetia, I'm sorry.
Go ahead, Ben.
Well, again, we've suspended the fares for 3 months now, and we're going to revisit that. So we'll see what happens if that goes forward or not. Again, our fares are the true cost of a dial-a-ride paratransit. The true cost is $34 each way, and in county, our customers pay $2.50 each way with a reduced fare card or an ADA card or senior citizen. So it's very economical. Even the normal rates are extremely economical. But you know, we're in our 3rd month now of fare suspension. So I don't know what's going to happen. We'll see. We're going to revisit it.
And piggyback on Lake Tran, I think what Lake Tran has done is phenomenal. When the news came out, believe me, RTA was just saying, how can we do that? But unfortunately, at this time, we're not in that position. Again, we have never reduced paratransit, and usually that's about $65, depending on who you ask, $55 to $65 one way for a trip, and our customer pays $275. And we're really looking into how can we create a new fare media structure and a whole in the future. So we are looking into that, and hopefully something will come in the next couple of months with more funding available.
Okay. This next question is for you, Venetia. How long has the wait time increased for RTA?
In regards to scheduling wait time,
I'm not sure. That's all they said.
Okay, so right now I can say we have 16 reservation operators when it comes to scheduling. I'll just start with that. And I've seen a significant wait time of 1 minute or less because I have agents that have 3 calls an hour, if you want to put it in that perspective. So there's basically 0 wait time. But we have seen a slight increase where we went from 100 calls a day to roughly about maybe 350 calls a day right now. So very minimum wait time, as it has been, we have not seen those numbers in a very long time. When it comes to waiting in regards to operations, so your live day of travel, we very seldom outside of peak time, I have seen someone wait outside their window. So on-time performance as of right now with RTA, and actually have the numbers here, has been 95% overall with contracted services and RTA.
Okay. Janice, this is to you. We've had a number of people expressing their condolences, and just know that you are in people's thoughts and prayers, and ours too. So
Thank you.
just know that. I'm checking to see what else. Is RTA continuing to provide service to the outlying suburbs such as Strongsville and North Royalton?
It's a very good question. If we've had service there previously, or you're within that 5-mile radius because service was there at one point in time, you will have it. Outside of that, as of right now, there are no exceptions.
Okay. See if there's anything else here. I'll go through one more time. This is really kind of cool. This program doesn't do almost like timestamp questions. They do it by the person. So the person has signed in and written something else. It goes back up to their name. I just want to make sure I didn't miss anything, because these are great questions. We're having a number of people saying thank you very much for providing the information.
Absolutely.
Welcome.
Okay, I think that's it. Okay, that's it.
All right.
So with that, I want to thank the participants again. I want to thank the speakers. I want to thank the DD Council and Western Reserve Area Agency on Aging. It's great partnering with all of you, and we'll catch you next week. So thank you.
Very good.
Thanks,
Thank you.
everybody.
Bye, all.
If anybody is still on and you can hear me, if you need certificates, remember to sign out.